Hello and welcome to VAX Facts and FAQs. VAX Facts and FAQs, or VFF, is a virtual discussion on how to stay healthy and get up-to-date information on flu and COVID-19. This month we'll discuss the public health emergency ending and kind of recap that. We'll talk about when to test for COVID-19, when to seek treatment for COVID-19, and some tips on staying healthy while we travel this summer. And of course, our FAQs at the end. So first we'll be and kind of recapping that. So as an overview, let's talk about what the public health emergency declaration was. So the PHE was in place since early 2020, kind of at the heart of the pandemic. And it just ended on May 11th, 2023. This emergency declaration gave the federal government the flexibility it needed to manage the pandemic. So this included waiving or modifying requirements like for Medicaid, CHIP, and private insurance. We're going to touch on that later today. Additionally, Congress was able to enact different legislation and provided other flexibilities in areas that were tied to the public health emergency. And so, a lot of those flexibilities ended on May 11th, 2023. So we just want to make sure that we get a quick overview on what ended and what was affected and what wasn't affected. And if you want to go more in depth with us on this topic, you can look at our April VFF presentation, and we touch on these individual topics a little bit more. So what hasn't been affected and what won't be affected is access to COVID-19 vaccinations, treatments, and treatments like Paxlovid. These will not be affected because these are based on the supply that the federal government has, kind of like in a stockpile. So as long as this stockpile is available, vaccinations and treatments will not be affected by the PHE ending. The FDA will still be able to utilize emergency use authorizations, and those that were in place are still in place. So those treatments, vaccinations that are still operating under the EUAs, they are still intact. Telehealth got some different flexibilities in terms of prescribing and meeting and things like that. So those will stay in place as well. And on a positive note, the government response to long COVID will not change. The government is looking into researching, monitoring the effects of long COVID, the effects of COVID-19, and those efforts will continue. So what will be affected will be Medicare and Medicaid waivers and broad flexibilities for health care providers. So those will end. And again, if you are seeking more in-depth coverage of that, I would really encourage you to look at our April presentation. Coverage for COVID-19 will change, but the U.S. government is maintaining a strong stockpile and distribution channels. So this is especially important for people that are underinsured or uninsured and are concerned about having to pay out of pocket for COVID-19 testing. Hopefully through some channels and distribution channels that these tests can be available for free for some. And when it comes to your private insurance, you still want to double check. A lot of private insurances did opt in or opt to provide testing for free, but they're not required to. So that may change on your individual insurance levels. So you may want to look into that as well. And COVID-19 data reporting and surveillance will change. We're already seeing that change. And we're going to talk about that on the next slide. So For data reporting and surveillance, we have grown accustomed to having an influx of data regularly on the spread of COVID-19, the severity of the illness, different variants and how they're spreading. But the Department of Human Health Services will no longer have the express authority to require this data from labs, which will affect the reporting of some data and surveillance. However, there is a lot of data that we still have access to. And what this image on the slide shows is we can infer some things from the data that we do have access to on a regular basis. So hospital admissions can help track the spread in communities and the severity of illness. Death certificates can track severity of illness. Emergency department visits can help track the early signs of spread, or the early signs of rapid infections, and genomic sequencing will continue to help us track new variants. So what we may not see anymore is, getting the spread in communities, the severity of illness, and the signs of spread from test results from COVID-19 tests. I think that's the biggest difference here. So while we will continue to do data reporting and surveillance, there's no express authority any longer due to the public health emergency ending. Another key change that is very important to highlight is that Medicaid renewal processes were stopped at the start of the federal COVID-19 public health emergency. But with the end of the PHE, renewals are restarted. So if you have Medicaid, My Child, Healthy Michigan plan, you may need to go through the renewal process. So this process is to help find out if you are still eligible for free or low cost Medicaid insurance coverage. So the steps, include updating your address, phone number, and email address, report any changes to your household income, check your mail, and you may need to fill out a new renewal form. And if you have questions, you can call the beneficiary helpline toll-free for the state of Michigan at the number on the screen. Or you can visit the website, michigan.gov/2023 benefit changes for more information there. So about testing and treatment for COVID-19. With these changes and it's confusing to know what your access is going to be. So with that question of access to treatment and access to testing, while it should not be affected too largely at the moment, it's still important to know when you should utilize these tools, and that can help manage some of the anxiety of, oh my gosh, do I need a test? Oh, do I need to seek treatment? So this is why we are going to cover that today. So the rule of thumb for when to get tested for COVID-19 is if you have symptoms of COVID-19, you should test immediately. And when you have symptoms, but you do not have symptoms, but you have been exposed to COVID-19, and someone that I've been around has tested positive or has symptoms as well, wait at least 5 full days after your exposure before taking a test. And this can kind of help eliminate that false negative. When I got COVID-19, the first time I tested too early, and I received multiple negative tests even after I started to get symptoms, and then I finally tested positive. So this waiting period is really important to ensure that you get an accurate read on your test. So COVID-19 treatment. So if you have COVID-19 and you're more likely to get sick, so if you have chronic health issues like chronic kidney disease, or if you have a weakened immune system in any other way, treatments are available to help that can help reduce your chances of hospitalization and death. And the key part with seeking COVID-19 treatment is that the treatment should be started as soon as possible. This helps it be the most effective. So don't delay getting treatment if you are someone who is at a higher risk for severe COVID-19 complications. And you want to, reach out to your doctor as soon as possible to begin this treatment. And so along with like the antivirals and things like that, there are other medications that can help reduce your symptoms and help manage the illness. The antivirals are helpful, but if you're experiencing other symptoms, you can speak with your doctor about managing those symptoms as well. And there is a treatment locator on hhs.gov that can help you find a location that's offering testing or treatment, or a pharmacy where you can fill prescriptions for your treatment. So that is important. We remind you asking, especially when you're having symptoms or you think you may have been exposed when you're in that waiting period. Masking is effective, though it's been long debated throughout the pandemic. There's been confusion in the beginning on when a lot wasn't known, but now we do know that masking is effective, and we want to encourage you to mask when necessary. I know masking may not be something we do all the time like we used to at the beginning of the pandemic, but it's a great tool to have in your tool belt to reach for when you're not feeling well, or you're in an area with poor ventilation, when you're traveling and you're using public transportation, or you're in an airport, things like that. So, and again, this is just one layer of protection. You still need to wash your hands, practice other good hygiene, coughing into your arm, sneezing into your arm, things like that. Those are all good layers of protection and tools to utilize to make sure that we can stay healthy. And we can make sure we stay healthy, especially while we're traveling and enjoying the nice weather that's starting to pop up in some places. It's getting a little nicer where I'm at. So we want to talk about some tips to stay healthy. So for traveling with COVID, or with the risk of COVID-19, we want to talk about what you can do to prevent COVID-19 while traveling. So of course, you can get up to date with your COVID-19 vaccines before you travel to protect yourself and others. And this includes making sure you're up to date on your boosters before you travel. Also, like we just mentioned, considering wearing a mask while in crowded or poorly ventilated indoor areas like public transportation and airports. Again, it's just another tool that is effective of preventing the spread of COVID-19 and contracting. So again, add another tool while traveling to help prevent COVID-19. And if you have a weakened immune system or at an increased risk for, severe outcomes from COVID-19, we encourage to talk to a healthcare professional before you decide to travel. And if traveling, take multiple prevention steps to provide additional layers of protection. So maybe you spend more time outside while you're traveling rather than being indoors. When you're indoors, maybe you are masking regardless of, how crowded it is. If you're unsure of the ventilation, maybe you're masking on a more regular and consistent basis while traveling, utilizing hand washing, hand sanitizer when hand washing isn't available. And all of these things in combination can help protect yourself and your families from these outcomes, especially if you have a weakened immune system or at an increased risk. And in red, in big letters at the bottom, if you develop symptoms, stay home, stay in your hotel. If you have or think you may have COVID-19, and seek treatment early if you have a weakened immune system or at an increased risk for disease. And I think it couldn't hurt to have a game plan for when you reach your destination on how you will proceed if you unfortunately do contract COVID-19 while traveling. Having that additional game plan to just keep your mind at ease in case that does happen, even though I know that's kind of planning for the worst case scenario, but it could only benefit you to have that backup plan and not need it versus need it and not have it. All right. The first question is, does the CDC profit off the sale of vaccines? And this is kind of a confusing topic because the CDC does have patents for vaccines. And these patents aren't profits from the sale of individual vaccines. And that is not the source of revenue for the CDC. And when it comes to the individual vaccines, the CDC actually buys vaccines to be able to supply to the U.S. population through those multiple dissemination channels. So health departments, pharmacies, doctors' offices, and how those things are spread doesn't necessarily profit the CDC. So profiting from the sale of vaccines, it's kind of lacking the context that the CDC purchases vaccines from, the developers, kind of like wholesale so that they are able to disseminate it throughout the population. But they do not profit from the sale of vaccines, and it's not a source of income that they can then do whatever with. That is not true. And they get the vaccines so that the U.S. population can have them. They do not own the vaccines in the sense that they develop to then sell for profit. Do COVID-19 vaccines harm our immune systems? And this is, in short, no, the COVID-19 vaccines do not harm our immune system. How the vaccines work is they allow our immune systems to respond after it comes in contact with COVID-19 virus. So it's allowing our immune system to recognize the virus so that when it does come into contact, our body knows how to react. It's not the first time it's seen it, and it doesn't have to work as hard and make us as sick to fight off the COVID-19 virus. And that's how it works. It creates a response in our fighter cells that fight off the disease. And there were some concerns that vaccines harm those specific cells. They're called T cells. And that's not the case. There's no research that indicates that that's true. It actually indicates the opposite, that, like I said, the vaccines increase those T cells' ability to fight off the virus that it comes into contact with. Are the U.S. and global vaccine catch-up campaigns going to force the vaccination of children? And the answer to that is no. The catch-up campaigns that you may see, especially going into the fall when we're going to back to school season, it's to kind of remedy the situation that we're finding ourselves in, where the pandemic has caused for some people to fall behind on their routine immunizations. So these are immunizations that, may require boosters. These are the immunizations that may be required for enrolling into school. So we're talking like HPV, Tdap, and those types of vaccines, and not COVID-19 necessarily. So those routine immunizations that kind of shine a light back on vaccine preventable diseases that kind of took the back seat during the pandemic. So making sure that, parents and caregivers, doctors' offices have the resources to kind of help the US, globally, children and adults get back on track with those vaccines. Like I said, they did take a backseat to the pandemic, understandably. So we just want, these campaigns are just to kind of give those vaccines, those vaccine preventable diseases, the spotlight again, now that we're moving into a different phase of the COVID-19 pandemic. So yeah, these campaigns are not to forcefully make children get vaccinated. That is not the goal. The goal is to just spotlight those vaccine preventable diseases, to remind people that they are vaccine preventable, and that they are available and they are recommended, that you follow the sequencing, or to make sure you have a certain number of vaccines by this age and things like that. So that's what those campaigns are designed for. So with that, I thank you for watching our presentation. And as always, if you have questions or feedback, you can email reach@nkfm.org, or you can visit nkfm.org, our website, and see the information and resources we have available there. And thank you, and I hope you have a great rest of your day, and we'll see you next month.